Welcome in. Hi. Hope everybody's Wednesday evening is going well. We'll give a minute or two for folks to pop on in. Um, but I'm really excited to be joining you again on Wednesday for our Fighting Back Lessons from AIDS for COVID-19 series. We have some really wonderful panelists tonight. And as usual, we have our executive director, Terry Beswick, moderating. I'm going to start the conversation off just with a little bit of housekeeping for Zoom. If you are not familiar with being part of a Zoom webinar, my name is Lee Pfeffer. I use they, them pronouns, and I am the Museum Operations Manager with the GLBT Historical Society. And what we're going to do tonight is Terry will be moderating the conversation, and we will be having our panelists respond to questions and discussion prompts and having kind of a roundtable conversation. You as panelists are welcome, or you as attendees are welcome to chat amongst one another or send messages to the panelists within the chat function. If you look on the bottom of your screen, you should have a couple of different options. There's chat, Q&A, and raise your hand. If you are in the chat, please, if you want your message to be seen by everyone in the webinar, make sure that you select all panelists and attendees. Otherwise, you'll only be sending the message to us, and no one else will be able to see your sparkling comments. If you want to send a private message to any one of us, you can use the little drop down, and you'll be able to send a message to panelists only. We will be taking questions throughout, and we'll reserve some time at the end for an extended question and answer section. But if you have something that you would like to ask the panelists, feel free, please, to use the question and answer function. What you'll be able to do is type your question in, and then we'll be able to see that in a queue, and you'll be able to see which ones we've decided that we're going to be answering live, or you might get a text response back if it's something really quick and we don't have time for it. If you have a comment that you would really like to make, and it's difficult for you to put it in the chat function for the Q&A, you can press the little raise your hand button, and that will signal to me as the moderator that you want to speak, and we can unmute your microphone and you can ask your question that way. And so I would love to welcome everybody tonight and introduce Terry Beswick, our moderator.
Hey, thank you so much. I hope you had a good time taking a few days off.
I did.
From your bedroom.
Staycation.
Oh yeah, okay. From interacting with us. So yeah, it's so important for us to self-care, even though we're like supposedly, all sheltering in place and working at home and, taking care of ourselves. And with respect to work, I think it's important too, because, it's so challenging and it can, I took a nap just before this, which is why I was running a little bit late to meet you guys beforehand. I was like feeling zoomed. I was zoomed. So anyway, I'm here. I'm happy to be here, and I'm so delighted to have our panel here tonight. I know most of you pretty well, or we've had you on panels before at the museum. And so, in this panel, we started shortly after the inauguration of Trump, this panel series discussions. And we really thought that it was important for us in this time of political crisis that we were like looking at the daunting prospect of 4 years of Trump as president and thinking, there's so much work that needs to be done to just protect our basic rights, and what can we do to try to inform contemporary social justice movements in the context of our queer history and our work to get those rights, and continue the path of social justice. And so those have been really invigorating discussions. And I know that Sammy, we had you on one panel, and I think maybe Harry, and I can't remember what they were exactly. But anyway, tonight we're brought together by an epidemic that has reached around the world, has really disrupted the very fabric of our lives and our economy, and struck down so many people. I think we just hit 1 million people infected that we know about, or 1 million cases in the United States, and over 50,000 deaths. And and I can remember these demarcation points in the AIDS epidemic, when we started reaching those kinds of numbers, and kind of took longer, and our sense of time and of pressure, and also the way that this epidemic is touching a lot of different kinds of communities and people feels very different. And yet there are a lot of similarities, sort of, in the ways that we feel about these epidemics, I think, in the way that we respond to it. So this particular series that we're doing, looking at COVID in the from the perspective of HIV and AIDS, is I think very timely. And so I'm hoping that tonight we can dig a little bit into, or deeply even, into an aspect of COVID that is, I think, really critical to discuss. And so, I think from the beginning, when we started seeing reports of the COVID outbreak in China, and we started seeing the travel restrictions coming out of the US and other country, and we began to see uh, physical attacks and personal attacks and online attacks against Asians in particular, Chinese people, or in Chinese Americans, and more broadly Asian Americans, with from people that were just acting out of fear, or exposing levels of racism that were already there. And then we began to see that COVID was touching uh, older people, or attacking older people in particular. And then you see examples of racism, and then African Americans, and then just people that are perceived to be possibly COVID positive, and people that are homeless. And so we're kind of seeing a lot of the same kind of phenomena with COVID that we saw with AIDS in different ways. So we're here tonight to talk about that. I'm really excited to have this great panel. So I just want to briefly introduce everybody, and then we're going to go around and talk a little bit about your work, and then dig into the topic. So to begin with, I want to introduce Harry Bro. I know because he volunteers and is a docent at the LGBT Historical Society Museum. But he has also volunteered for many years as an emotional support counselor during the AIDS crisis. And um, and I think Lee is going to be posting everybody's complete bios on the chat panel. So I'm not going to read through everybody's bio to try to keep as much time as possible. But Harry is now a long-term survivor, and continues to speak out and defend the less fortunate and disenfranchised by volunteering in various advocacy and social works, such as Elizabeth Taylor Network 50 Plus, and the HIV advocacy networks at the San Francisco AIDS Foundation, Castro Ambassadors, and, as I mentioned, the Historical Society Museum. Vince, I've known for many years. Vince is a queer Chamorro man who has been living with HIV.
Tomorrow.
Thank you. Has been living with HIV for over 30 years. He's currently the program director of the Elizabeth Taylor 50 Plus Network. And he's been active in the LGBTQ community for over 35 years. He served as a community grand marshal of San Francisco Pride last year. And so we're really pleased to have Vincent here as well. I've served with Vincent on a number of panels in the past. Eric Watt is new to me. Hi, Eric. You're in LA, right? You're in LA, yeah. Eric is a writer and a community historian. He's the author of The Making of a Gay Asian Community, an oral history of pre-AIDS Los Angeles, and is working on Sex Positive, a follow-up history about AIDS activism in the Asian and Pacific Islander communities. His new novel, Swim, about drug addiction and family caregiving, was published last year by the Permanent Press. And I think we're doing a reading with you about Swim this month, aren't we? Yes.
In May, late May.
Great. I'm excited about that. Sammy Blaza Wills is an enthusiastic organizer with a vivid love for justice and strategy. I'm so excited to have you back. She's growing up in a hustling class Philippine family, immigrant family in Las Vegas. Sami was shaped by the cultural resilience, joy, trauma of their community. Joy goes by they and them. Actually, sorry about that. Currently, Sami is the executive director of APIENC, a grassroots organization building power for transgender and queer Asian and Pacific Islander people in the Bay Area. In their role, they support hundreds of community members to organize for rights, build intergenerational connections, and heal for trans justice. So thank you very much, and so glad to have all of you here. And I just want to go around maybe in the same order and just ask you guys to talk a little bit about your work and what you hope to get into talking about tonight.
Okay, well, that means me. I prepared a little 5-minute reading that I'm going to read about, I hope will cover the points that Terry put out in his thing about the guidelines of the topics he wanted to talk about. And I'm going to switch to my Word document and just take it off in reading it. As a little bit of introduction, I moved to San Francisco in around 70. So I went through all the 70s of all the breakthrough pride, gay events and activities. And then continued on in the 80s when everything turned upside down. So I have a little history that I like to pull from and will hopefully give a view of how I feel about all of this in this reading that I'm about to begin. As I think of the AIDS years, and I know it's not over yet, I can still taste the stigma. Stigma toward homosexuals was a prime reason the original response to AIDS was so completely bankrupt. The abandonment left scars that have yet to heal. Today, though difficult and tragic, it doesn't affect me the same as watching friends and acquaintances during those early years as they walked around courageously fighting to retain their dignity while losing their health. It doesn't compare easily, if at all. There is, however, one small way in which the response today could be considered worse. In the prior time, we were allowed to visit and support personally those who were ill. We could hug someone for comfort and consolation from the devastation. Someone we knew could hold our hand on our deathbed. Today, those interactions are denied us and left to the caring hands of healthcare workers. Today, we must be content to connect with pixels of light on an electronic screen during those direst of moments. With AIDS, there was much fear and confusion as the news began slowly to unfold, but there was no one to ask and nothing to reference. Certainly, there were no daily briefings from the administration. Our leaders were either scrambling to find answers or scrambling to ignore us. Stigma became prominent and palpable towards a vulnerable but identifiable group. During the years following, when the virus spread to so many other groups, the stigma had already become well entrenched and pervasive. It continues into the present. Who has it? How does it pass? What could be done to protect oneself? Those questions permeated the conversations about AIDS and arise again now regarding coronavirus. There was no internet then and little media coverage. Testing took years to develop due to a lack of urgency, as the virus was only affected gay men, and that gave it a built-in stigma, homophobia, one of the oldest and most pernicious phobias on the planet. Many in mainstream society considered us deserving of our fate, and in some cases, glad to see it happen. That stigma later expanded to include many persons, many who contracted HIV innocently. All were seeking, like today, a way to survive an attack of the immune system. Coronavirus has triggered a similar instinct to survive, a similar fear, a similar stigmatization. Finding someone or some group to blame became the base response for many then as now. Being able to meet the challenge with reason, understanding, and compassion may seek Many seek an escape of any sort. One nurse friend of mine put it this way: some frontline people have succumbed to, and I quote, some frontline people have succumbed to the illness. Some have run from the risk of becoming ill. Some have looked at it from a distance, and some have faced it head on. All of these responses are going to threaten the very core of any group of workers. Some groups will crumble, some will adjust, some will rise to the top. The same kind of fear that negatively labeled people so many years ago is threatening to do it again, unquote. Hope summons the strength in a few to mount the appropriate response. In the 1980s, some nurses in San Francisco General created Ward 5B and found this strength and drove on, afraid, but not deterred. They set an example and created procedures that changed the world, making today's battle more manageable. In that way, maybe this pandemic is like AIDS, individuals mobilizing their best efforts despite their fears. It's different though, in that those affected aren't the others, and the transmission isn't through behaviors that can spark prejudice. This virus sees no one as special or deserving of being passed over. It knows no geographic boundaries, no racial demarcations, no financial privilege, no religious belief, no age or sexual preference or practice. It sees only vulnerable and often frightened human beings. And yet many in our society have carved out an other where none exists, creating damaging stigma. Stigma focused on the Asian American populations, focused on the older members of society deserving our protection and homage, focused on the African American community already suffering from health inequities, focused most perniciously on certain healthcare workers. Invoking stigma against these or any others hurts us all. We all have the same stake in this game, yet many prefer to focus on the otherness and act odiously. We find a dedicated group of health workers of all types and talents, giving the hope needed to assuage the fear, combat the stigma, and bring us to sensible actions, ignoring the who, why, and where it came from. Healthcare is our right, but stigma has created so many obstacles to that right. My dictionary defines stigma as a mark of disgrace associated with a particular circumstance, quality, or person. To me, AIDS is not a mark of disgrace, though many who are fearful still perceive it so and inspire stigma. To me, coronavirus is not a mark of disgrace, though many who are fearful still perceive it so and inspire stigma. May those of us who can fight back and continue to speak out against stigma now and forever. Thank you.
Wow, Harry. I guess we can just wrap up now. No, I'm kidding. That was good. Sammy, Sammy, you want to go next?
Oh, I was just saying bye. Harry really dropped the mic, you know. But I'm happy to go next if that's all right. Hi everyone. Good evening. My name once again is Samia Blaza Wills, and I use they them pronouns. I'm the current executive director over at APINC, and at APINC, the core of our work is about building power for trans and queer Asian and Pacific Islander folks. And I was sharing with people briefly as we were preparing for this call that for me, coming into this work as a young person, I came in as an intern originally in the organization. I was very fortunate to meet people like some of the folks here who are my fellow panelists who have been doing work in social justice communities, in movements, fighting stigma, fighting for rights, fighting for connection and relationship. The people who have been doing that for many, many years. And I think for myself, being able to be in touch with my histories, with my living histories, has been a powerful lesson for how I want to move social justice work forward. And for us at APINC, this moment is a trying and challenging time, right? At the intersection of LGBTQ and Asian and Pacific Islander, our folks are experiencing the historical trauma of this moment come up, They're experiencing the anti-Asian harassment, all of the things that are happening, whether locally or to their parents or people in their homelands, to the very real reality that many young folks and trans folks, the inequalities exacerbated, the inequalities have only been exacerbated in this moment. You know, we have folks living in unaffirming homes. We have people without access to healthcare being denied access to healthcare. And so in this moment, and in all moments of crisis, APINC has really turned back to our histories to understand how to move forward. And the thing that I hope to talk more about as we talk more about stigma is also talking about connection. I think we've really learned from the HIV and AIDS crisis that in moments of hardship, turning towards each other is the way that we're going to get through this. Asking for and offering help, those are the things that are going to help us survive, going to help us thrive, going to help us create the things necessary to get through this moment. And so we found multiple ways to do that at APINC, and I look forward to talking more with you all tonight about that, because I think staying connected and being in relationship is one of the most important things we can do for now and well into the future as we continue fighting for a more just and equitable world.
Unmute myself. Thanks, Sammy. Vince.
I was going to ask Eric to go next.
Okay.
Eric, you want to go? I like to listen to everybody.
Do you want me to go first, Vince?
It's fine.
Sure. My name's Eric Watt again. My pronouns are he, him, and his. And I'm working on what I'm called community memoir of AIDS activism in the Asian and Pacific Islander API communities, specifically in Los Angeles. I actually came to this country when I was 12 in 1982. And that was sort of my sexual coming of age too, right? You know, so that, and then when my political coming of age is sort of around college in the early 90s. So AIDS has always been in the background, both of those coming of age, and it's going to inform how I think. So it's been really a pleasure to be able to collect these stories of AIDS activists in the community and sort of reflect how, as I was telling folks before the call, how it has really lit the fire under me and be reminded of that. And I think this conversation is going to reinforce a lot of that too, because I do think there are a lot of, even though it's bleak as the situation has been, I do think there are a lot of good things that might come out of this. I also want to just say that like a pandemic is not just a medical issue, right? It's a public health issue, which means that it is something that we all have to chip in to solve. And that's why there's so much emphasis on testing, either in the HIV/AIDS epidemic or also in COVID-19 as well, in different ways, right? And growing up like in the shadow of AIDS, it was been thrown into me that I need to get tested every 6 months. And I still do, right? Maybe not right now, I can't go right now, but you know, this is something that became so secondhand nature to us. And you can tell that like people in COVID-19, people would say that like, well, just assume that you are carrying COVID-19 or the person that you interact with will carry COVID-19, so that you will behave in a safe way, right? And that's kind of advice that I was getting as a young person, young gay man, about having sex during those years of the AIDS epidemic. You know, it's always wear a condom because assume the other person have it. Because you can tell by looking at someone whether or not they are infected, in fact. So stigma, to me, it's important because it's one of the major deterrents of to discourage people from getting tested. And you'll see in a lot of HIV prevention during that time, it's really about trying to get people tested. But in the API communities, because there's such a conflation of gayness and HIV, the stigma, it's not just about reducing AIDS stigma, but it's also reducing stigma of gay people, LGBTQ people. But specifically gay men, right? A lot of messages are really geared towards gay men at the time. So if you can think about like someone who is in the immigrant community, who is monolingual, who's limited English efficient, if this guy who might be having sex with men, who might not identify even as gay, he is not going to go to a mainstream AIDS service organization to get help. So, because that organization probably didn't have the cultural or linguistic skill to help him. And he can't really go to an organization in his own immigrant community because for the fear of being found out, right? So stigma comes with that exposure. So that's why I think a lot of prevention work about reducing stigma during the AIDS crisis actually benefited people like me who were coming of age, who were not HIV positive, right? And that's one of the lessons that I drew from this activism, that you always fight for the most marginalized because that's how you lift all boats. I also think that there's a lot of creativity, a lot of innovation that happens with AIDS prevention in the 80s, partly because we have seen nothing like it before. So people had to be creative. There's no blueprint. So I also think there are a lot of innovation now, right, in how people are helping each other in the communities and the mutual aid that's happening, the use of technology. So I'm also very encouraged by what has been brought out. I think in some way this has brought out some of the best thinking, in our community too. So I'm also very looking forward to talking about those positive things that are coming out of this pandemic.
Thank you, Eric. That leaves you, Vince.
Thanks. I was going to use the excuse that I've been collecting my thoughts, but who knows how who knows how collected they're going to be. If any of my members of 50 plus are out there, thank you for coming. Some of you have been texting me, asking me for the password, but I'm not in that meeting. So please text Dusty. So, I was 24, 25 living in New York when the AIDS epidemic hit. And my first taste of it was I'd left Japan and I moved back to San Francisco, and the Castro was a ghost town. It was not the town I recognized. I went to New York for a visit and ended up staying for 6 years. And I remembered having a job at a bar, and the people that I would hang out with on the weekends, they were not showing up. And I found out one in particular was sick and that he was at St. Vincent's Hospital. And so I went to go visit them, and I couldn't find them because there weren't enough hospital beds. And everybody was in the hallway on gurneys, and there were so many people that you could not figure out who was who and what their names were. And I never realized what an impact that had on me until this current day, that to have that image of people without proper medical care, without proper identification of who they were, where they were, just stand on the halls until this thing came up. And it's been traumatizing, and I also remembered that that was a lot to go through in your 20s, and how you could go through that and not think it would affect you. Because for some reason, when you talk about normal, the only thing I have to compare it to is my life. And I don't know what normal is, I was talking to some of my colleagues, and I had to run my office in Bangkok at a time when the country broke into civil war. To me, that was normal. So, COVID, this thing, people are doing this. It's just something else that I had to do. And I just never realized how traumatizing that was, and how much trauma I've lived throughout my adult life. And so this time has really given me a chance to think. And I'm really grateful to APINC, the organization that Sammy runs, because I feel like they've given me this opportunity to kind of revisit that 24, 25-year-old and kind of send some compassion, like seeing these young people being who they are, being told to just be who you are, and we've got your back, we'll support you, is so novel to me. I mean, my experience with the API community initially was like, they criticize you a lot. There's a lot of stuff about keeping face and, maintaining that. And it was always kind of scary to me. But anyway, in the 90s, when HIV did hit the API community, I was very, very angry. And I think I was hard to be around people because I was so angry. I would be with people and I never know this was the last time I was going to see them, you know? And, but at one point I realized I had to swallow that anger because people just couldn't handle it. And I think what's starting to happen now is I'm getting in touch with that anger. And, you know, that people aren't in just out and just, well, I guess you can't go out in the streets because of social distancing, but that when we heard how this is disproportionately affecting Black people, like how many times do we have to hear that before we go out there and say, hey, you know, every time the person in office called this a Chinese virus that nobody said anything, you know, it's like we don't get a chance to write a lot of the things that are wrong. Like I feel like I have a chance to kind of right some of the things. Like, you know, I know what I did the first time around, and I'm not going to make that mistake the second time around. And so, you know, I no longer apologize when I speak my truth, and I think people are going to be uncomfortable with that. But I always find, and I don't want to keep going on because I don't want to sound like I'm preaching, but I do find that I have to go back to my API community when I need to be grounded. Like that's where, like my identity as a long-term survivor, as an elder, that's the perspective where I draw the most strength from, and I can go out and serve the other folks. Because I define community very broadly now, but I find that I really need to, and it really just hurts me when I hear about this, you know, these acts of violence that are increasing, that nobody's saying anything. And so I just hope that I don't know what I'm going to do with this anger, quite honestly, because sometimes I'm so angry I can't even watch the news anymore. But I do think we need to do something. I mean, it's just inexcusable. And I think the people, like, I understand the people that are running the coronavirus task force, they have to be careful because the president's the president and he has a lot of power. But I'm like, I'm sorry. The rest of humanity, the rest of the country depends on what comes out of this. And the fact that you're thinking about your career and your position when you don't really say anything, I just question that. I think, you know, that this fear that we have, yes, I understand this is a pandemic. I understand people are dying, but that fear keeps us in check. And that makes me really, really angry. I'll stop there.
I'm so glad Vince didn't have anything to say.
Yeah, we're definitely going to circle back to a lot of the themes that came up from each of you. We heard some really great stuff. And how to begin? I think let's begin at the beginning. You know, when I try to break it down, like what is stigma and how has stigma functioned in relationship to the HIV/AIDS epidemics, and now with the COVID epidemic, I think about the sort of the trajectory of the history. And when I first became aware of stigma in relationship to HIV and AIDS, it was around the people who were perceived to be most likely to be HIV positive or have AIDS. And later, stigma became, for me, more a function of who had HIV. And at least in my life, that became sort of like the point of discussion, is how people with AIDS, people with HIV, were stigmatized by virtue of the fact that they were positive. And so some people would be in the closet about their status. And then there was the whole empowerment movement, which was really galvanized by people who boldly came out and said, I am a person with HIV. In San Francisco, Bobby Campbell was a famous example. But going back to the beginning, so can you any of you like talk about those early years, and with respect to HIV and AIDS, and the groups that were perceived to be likely to be HIV positive, and how stigma sort of manifested in our society back then, in terms of the response to those individuals or groups, or how those individuals and groups reacted to that kind of stigmatization. Do you have any thoughts on that, Vince?
Well, sometimes I think stigma is a word that people hide behind, because if you talk to people like in the streets. A lot of them don't know what the word stigma means because they don't use that in their day-to-day language. But you tell me, people are getting killed. People aren't getting services. They didn't allow this person to go into this place, which he had every right to go into. I mean, so I think sometimes you just have to unpack it for people. I think one of the questions you asked us earlier is like, how do organizations, fight or do the stigma? I think sometimes some of them actually perpetuate it. Like, and I'm going to use this as an example. Like right now, like a lot of times people who serve older people, for their for some things they use like these people who are doing the splits, doing yoga, superhuman people at 90 or 100. But then when they need money, they trot out the most tragic story that that they can find, and then they'll give us money for that. And I just think there needs to be a balance with that. With HIV, I mean, it was, there was an excuse to really for people to have the excuse to express their hatred for gay people or people who are different. I mean, I worked with sex workers, I worked with folks who are trans, I work with people who use drugs, and it's people that most of society considered to be marginalized. It's like, let's just talk about the people. Let's not hide behind the stigma. Let's talk about the people and what's happening to them, because this is what's happening. And I think death is very scary, and it's often used as a way to kind of silence people. But at the same time, sometimes life is scary, living, because if you have lived through this, and like Harry and I who lived through this and seen what this has done, you don't ever want to wish that on anybody else. And so I think, you have a responsibility to step up. I'll be quiet.
Yeah, I mean,
I feel very strongly about some of these things. In fact, I didn't know how strongly I felt about it until I started talking about it.
yeah.
But I think that as a country, we really need to find our moral fiber. We really need to say, this is not right. We really need to rethink, as a person of color, I'm called a minority. But the truth of the matter is that people of color are the global majority. They make up more, and so we need to start changing those conversations, because there's been a way that we've been told how we need to participate to be accepted. But I think that we need to change that. It's like, no, we don't need to be accepted. We're going to do our thing. And if you want to come along, fine. And I talked that about to the majority,
Yeah. Yeah, I think it's, I do recall in the early days with HIV and AIDS that my growing sense of horror when I realized, how HIV was impacting gay people, in particular, gay men in particular, and specifically how it was transmitted sexually. And this is in the relatively early days of the gay rights movement. It was, early 1980s. And so already on top of layers of cultural homophobia that was there, you had this sort of excuse for people to express their homophobia. Anybody else want to sort of on this topic, Eric?
Yeah, I was going to say that the stigma, because there's this conflation of gay men and HIV and AIDS, there's this assumption that if you were gay, you either have AIDS or you're going to get it eventually. So I think, this is why the stigma reduction, it's more than just HIV at the time. But it was kind of crazy, right? Because the whole idea of, when you watch one of those contagion movie and people are in a spacesuit when they get into a room with someone with virus, I mean, that came from HIV, like universal precautions, right? The fact that they actually have debates whether or not you can give CPR lessons. Like, what if someone kisses the mannequin, try to practice on the mannequin, and that person have HIV, is that going to transfer to me? Like, these are conversations that medical professionals have had. So there are a lot of really brave people who were doing the right thing, but I think there were a lot of people who were too, who didn't know what the right thing was. So there was definitely a lot of stigma. The thing I would say too about that period, what I come to find too, is just the way people came together, how the community fought back. the stuff, the resistance, the fighting to be seen when there was so much denial, so much like, what is it? Reagan didn't talk about AIDS until what, 1985, right? This funding didn't happen. Ryan Care, when was Ryan White Care Act was passed in early 90s, I believe, under George Bush, the first one. So there was a lot of erasure, but at the same time, like, there was also a lot of stories about people taking care of each other, the kind of mutual aid that you see in response to COVID-19 as well. And I think that really humanized a community that has been so stigmatized, right? Like the LGBT community. Like, I'm not talking about just gay men, just sort of the kind of participation of lesbians and bisexual and transgender folks who are in the movement. It just kind of showed the world a face of LGBT community that they have not been exposed to. So that I think changed a lot of mind about like what this community was, right? And I always went back to that because I felt like, this is important for us to learn how to fight back.
Yeah, Sammy, I think I saw you holding a thought.
Yeah, well, I really appreciate what Vince and Eric have already shared about stigma. I think that Vince is right? Like, people aren't going around being like, I'm gonna have stigma now, but the way that it is enacted shows up on so many different levels, right? And I think for me, what I've acknowledged and noticed is that stigma is mostly about fear. I think a lot of things, like a lot of harmful and negative things that people do generally are about fear. But what stigma essentially does, in my experience, is that it creates the fear of the other. It's an otherizing tool in society. And that otherizing then prohibits those people from accessing services, being integrated into institutions, being cared for, being in relationship with. I think stigma really diminishes relationships and divides people. And if it, was the HIV and AIDS crisis or the current pandemic, this is a time in which people mostly need connection and care. But by essentially otherizing people, those folks are silenced. Value is placed on certain things, right? Like, value is placed on the healthy, like the fit, the people who could show up in a certain way, people who have ability in a certain way. And I think when that stigma hits, it embeds itself into the fabric of the different institutions that are supposed to be ideally serving everyone, right? And so we see how things that took hold during the HIV and AIDS movement, some of the negative things, are still persistent today, right? Like, folks are still fighting the ban to be able to donate blood, which is ridiculous, like so many years later, and there's a lot of blood needed, and that's still a fight that's happening. And from that, I'm also thinking about, if stigma can take hold and root itself so institutionally, how can the powerful things that we create in moments of crisis also take hold and root institutionally? So if we are fighting in this moment anti-Asian harassment and racism and prejudice and ignorance about Asian people, what is the transformation that we can create that will take us beyond this moment? Because this is not something that we can let embed in any institutions more so than it already has, right? Like, as Vince was talking about, the fact that so many Black folks have been denied access to medical care, just in the Bay Area and the city of Richmond, all of the recorded cases of COVID that have resulted in death are all Black folks in Richmond, California, right here in the Bay Area. That is unimaginable and unacceptable. And so I think as people, as organizers, as people part of a just society, trying to create a just society, we have to imagine what are the cultural, structural changes that we need to demand in this moment that will take root much more than any stigma or fear will.
Yeah, that's really great, and I hope we can, during the course of this, really begin to imagine the ways that COVID-19, how we're going to move through to the other side, and what kind of society we hope to create around that. And I think, like with AIDS, COVID is definitely sort of exposing not just, you know, we talked about the racism and the homophobia, not just exposing those kinds of isms, but the structural inequities that are there that are contributing to people being exposed to the virus, and then people not getting proper care, and as a result, a greater incidence of death. And we definitely saw that with HIV and AIDS also. And Eric, you reminded me of something I was thinking about earlier today, which is the Ryan White Care Act, and you know, which is, you know, a phenomenal piece of legislation, which was, you know, championed by Nancy Pelosi and others, that really got early intervention care into the hands of people with HIV and AIDS, and really dealt with HIV care in a very kind of comprehensive way that was really life changing for so many people. And yet, it occurs to me that it's named after a beautiful young man who's from the Midwest, white, who contracted HIV as a result of a blood transfusion or blood products because he was a hemophiliac. And it's interesting that we had to, you know, and he did some phenomenal work and totally deserving of having this act be named after him. His mother has gone on to do some wonderful advocacy work. And so I don't mean to diminish that by any means, but it's interesting to know, you know, it wasn't somebody like Pedro Zamora, who was a young person with AIDS who, you know, I believe contracted HIV sexually and was Puerto Rican, you know. It wasn't somebody like that. So we had to put forward this person who was the face of HIV and AIDS in a different way. And it wasn't, you know, it wasn't a gay person, it wasn't a person of color, or somebody, it certainly wasn't an IV drug user. And so I think about all the groups that were stigmatized in the early years of AIDS and still are today. And you know, and I think about gay and bisexual men, certainly. There were a lot of bisexual men who were just kind of like on the fence about their sexuality, and women, they were not getting um, uh, opportunities, romantic opportunities with women because they were, you know, bisexual, and so they really kind of like moved more to the gay side, for example. And then there were Haitians, of course, you know, and you had Haitians in the very early days, you know, and a lot of Haitian Americans were here experiencing discrimination as a result of the stigma. Um, so moving on, let's talk a little bit. Harry, did you have any thoughts that you wanted to throw in here about the early days?
Yeah, I mean, well, the stigma was strong. I remember the first time I knew about AIDS basically was probably around 1983, and they didn't really have a name for it yet, probably at that moment. But I do remember that I came home, and again, before cell phones, so on the answer machine was a friend of mine calling and saying, what you want to know is that this person, and he named him, died in San Francisco General today of this unknown gay disease. And that prompted me into action. I have always felt that part of the huge problem of it all is that we're able to readily find an other, as I mentioned in that thing I wrote. There's always an other. They're other kinds. They're not like me. I mean, and when you start at that, then any anger and any fear that gets connected, I fear will come out as stigma. It'll show up some kind of way where you are going to discriminate against that other. And we have yet to find a way. I mean, America was built up, and as a kid in school, I learned, you know, it was a melting pot of all these different races and colors and creeds and everything else. And yet it's kind of been hijacked to be a particular kind of way that has historically, it seems, always found a way to carve out an other of some kind of way. And we've never actually been able to accomplish feeling that we're all one nation, we're all Americans that all need to be participating to make it work, and how we can support each other in that. We seem to always take the easier route, which of course is to deny and deflect and stigmatize different groups.
So let's talk about, how stigmatized groups who had this stigma put on us through the HIV and AIDS crisis. And even if you want to talk about, like, with COVID, in the short history that we have with COVID, how did those groups turn it around? How did they fight back against the stigma?
For me, it's if you fight against something, it gives it energy and it gives it power. But yet you have to stand up and confront it also. So it's kind of a double-edged sword there. If you push too hard, you're going to create a wall. And if you don't push enough, it's going to run over you. So there's a balance that has to be struck where we have to somehow be able to come back to reason and be able to talk with each other in ways that's not happening, particularly as represented through our political structure. And everything right now seems to be heavily, I was listening to a webinar this afternoon, and they were talking about how the rural areas outside of the smaller cities, when the government funding comes down, for instance, is dispersed by the counties. And the counties often will then take that money and funnel it to the businesses like the hospitals and the official, quote unquote, healthcare entities. So that the smaller groups, what if they were churches, they'd be called faith-based, but they're not. They're community-based is what it's called. And those groups aren't eligible for these funds that come through, because you have to have the criteria of being a major, like, hospital. And all of the criteria currently, and probably for hundreds of years, is set up by a ruling class that, right now it would be considered the Congress and the government and the people running it. And it seems like the grassroots issues that we confront about trying to disperse the stigma and trying to make people equal and trying to reach all the Americans, even the ones that live out in the country, this is overwritten by a hierarchy that we can't seem to dissemble, to take apart.
Yeah. So, but as individuals, what did individuals do to try to counteract the stigma with relationship to HIV and AIDS? And you talk about it, I think that's very right, and it reminds me of my early days as a queer boy. How do you deal with the harassment and teasing in school, or do you fight, or do you hide? And I think, Eric, did you have something on this? Yeah.
I'm still percolating.
Okay. I'm thinking about coming out. I mean,
Right.
I'm just thinking about coming out specifically. That's what we did, and we talked about that earlier. But with respect to HIV and AIDS, what we had is people just coming out as being a gay person with HIV or AIDS, and as we did with our sexuality or gender, to come out and be proud of it. And later, I think we even got to a point with HIV and AIDS to be grateful for the disease, at least in our lives, the changes that it exacted, or the kinds of perspectives that it brought for us as individuals. Vince, I see.
Well, it just reminded, like, one of my first experiences in the API community when I first started doing this work, because in New York, when I was volunteering doing stuff, it was more of the mainstream and all over the place. But I remember our community didn't know a lot of people. There weren't a lot of people who were out, who were positive, and people were scared, because of what we're talking about, the stigma. And so the staff, it was Asian AIDS Project, which would become API Wellness Center, and the community would say, well, we don't know anybody who's HIV positive because, da da da, whatever. And they go, well, Vince Chrysostomo, you know him? He's HIV positive. You can't say that. I'm like, oh shit. It's like, I was like, what about confidentiality? It's like I was constantly being outed. And I realized though that, that was, maybe that's what my role was, to use that story, to use that, because suddenly you knew somebody and it became personal. And so my thing, if you focus on the stigma, we don't get any place, but if you focus on the people, I think Sammy talked about connection earlier, the connections that we have. I think one of the things that did happen, and Ryan White actually did this as well, when I think somebody said this in the chat, is at one point they tried to divide people with HIV, but those who were the poor victims and those who deserved it. And one of the things that I saw us do in the 80s and 90s is come together and say, no, it doesn't matter how you got it. It's a disease and it's preventable. And so we came together. Unfortunately, as Harry said, the country keeps finding ways to divide us. But I think if we focus on those connections, we can cultivate that. And we just make it personal. I also know that people would, often take issue with some of the things I said, but I said, you know what, this is my story. It's not up for debate. Because, and so I've learned, that's how I've learned to do my work. But I do think that if you keep it personal, and then the more people that you can, that you can cultivate and touch with that, the more people are going to say, you know what, this is not just their problem, this is our problem. A few years ago when, a couple years ago when North Korea was talking about bombing Guam, and people kind of made it a joke, and I had to tell somebody in the meeting, it's like, that's my home. It's like the fact that you're standing there and just thinking, like, that's my home, that's where I'm from. And so you can't say, but this, if you know me and you know my work and you value my work, then you can't say that you're not personally impacted by this. And so, so I just find a way to, whatever condition I happen to be inflicted on me, to use it to make my point. No, I'm teasing. I also think that humor sometimes, because when you talk about stigma, it's really icky and just kind of yucky.
Yeah.
But I know that for my culture in the Chamorros, we often say things that are inappropriate, but you know what? We get the message across, and we kind of create those openings where we're able to talk, and it makes it a little bit more personal.
I think
So,
hit
so
on
this is
something that I didn't bring up about me, but when I was, first off, I wasn't able to come out when LGBT was okay. I came out way before that happened. And one of the things that happened was during the AIDS thing, I remember having lunch with a friend, and at the table next to us was a female couple that was office people, and they were having lunch too. So my friend Sandra goes off, and they get in a conversation with these two women, and the two women, ask what she does, and Sandra's an executive placement person and all that stuff. Then they turned to me and they said, well, what do you do? And I said, well, I'm not doing anything right now because I'm recovering from AIDS. And their jaws dropped to the table. But it pointed out something to me that I didn't kind of realize I was doing, but it was just who I was, I guess. And that was that I've never kind of been in the closet about what was going on. I told people all the time that I have AIDS. Yes, I am a person with AIDS. I can't speak that language, et cetera, et cetera. And I think that's been kind of a personal crusade, and also a very positive thing in my life to have presented some kind of impact to what's going on, is by basically being willing to be out there in that way.
So how does this apply to COVID? And that's I think that's the question that comes up, because I guess the difference is, when you have HIV and AIDS, you're you can be out in public about that, and to be positive is means that you have the virus and you potentially could develop AIDS without proper treatment. And to be tested for COVID is a different kind of a thing, and to have COVID-19, or the virus that causes COVID-19, is for it's got a shorter incubation period. There's a period of infectivity and potential for illness and death, and then hopefully you become antibody positive, and immune to infection and not able to infect others. So it's really a different disease in that sense. And so if somebody's COVID positive, I haven't seen anybody become the COVID positive poster boy yet, like Bobby Campbell did with HIV and AIDS. So how can we combat the stigma in a way that's affirming of the identities of people who were stigmatized by as being possibly COVID positive? You have any thoughts on that, Sammy?
Yeah, I think that it's hard in this moment, right? Because the scale of COVID is like truly unprecedented, at least in my experience, right? Like the pace at which it is transmitted, the rate at which it's become a extremely global pandemic, the literal a pandemic that's hurting many, many people. And as folks were talking, I was kind of thinking about what are the things from that feel still relevant in this moment that I see parallels to. And I think there's two things. The first of which is that it is extremely powerful when people are vocal about their experiences, right? Whether that was during HIV and AIDS, when people could be vocal and say, this is how I'm being treated, this is how I'm being mistreated. That same thing applies now, right? We see how people are being denied access to testing, or we see how people have really, really minimal access. They're in rural areas. They have to drive 2 hours to get denied. They can't get any responses. How, undocumented folks and immigrants aren't getting a stimulus check and they can't go out and get jobs. How trans people are being, they're already having struggles with housing. Now they're being denied access to all of the housing programs that are happening across the nation. When people are vocal about their experiences, it creates a culture in which no one can say that did not happen, right? Like the collective amnesia can only go so far if people are vocal about what they're experiencing and adamant about the things that are happening that are true to them on a societal level. The more that people can be vocal about, here's my experience with COVID, here are the symptoms, here's what's hard, but also the systemic elements, the stronger the push will be to respond. I think the second thing that I think about that feels like a parallel in this moment is the strength in connections. And I come back to this time and time again, but I continue to, in this moment, be inspired by the ways that during HIV and AIDS, people checked in on each other. Like people did not leave folks to die. They sat by them until the end and beyond the end. And I think that is extremely important in this moment, even if it's gonna look different, right? We can't go to each other's houses and visit each other, but we can call each other. Maybe people don't have internet in their house. We can find a way to get internet to them. Maybe people need food resources. We can deliver them food, right? Like, what are the different ways that we can continue to care for one another with the understanding that by doing these different acts of care and support, we're ensuring that there are multiple avenues for people to feel connected and healthy and strong, even as there's this big, big push and big, big weight that people are having to carry. And that's like no small feat. I don't want to minimize. It takes a lifetime of work to be able to be comfortable asking for help. But I think it's a muscle that needs to be worked in this moment, because there's no way to get through a global pandemic alone. Like, the individualism of this country manifest through capitalism is not going to cut it if we need each other, if we need to rely on each other. And that's like a hard thing that's going to need to just be worked through now.
Yeah, Eric.
I was just going to add that I think some of the panelists have also addressed this. The stigma is not really the disease. Like, we don't really need people to talk about, having COVID-19. That's not the stories that we might need at this point, right? The stigma, it's really about the perception, people's perception of who has the disease. So rather than calling it stigma, let's just call it for what it is. It's racism. So it's really about how you fight racism, to me, So I'm not gonna, fault anyone from hiding from having the disease, because there are ramifications of being exposed or having that kind of exposure. But I think the lesson that I at least draw from HIV/AIDS and that experience is how people kind of not afraid to have difficult conversations, and to call things out, right? And then be confrontational about it and to put it on the table, so that it becomes part of the conversation. It just refuse to be marginalized, to have these conversations marginalized. So that's kind of what I think it's also happening, right? You do have these assimilationist strands sometimes in movements, to kind of Andrew Yang telling people like, just be more American, right? But I think for the most part, like in this day and age, that argument got so much flack, and it's just stopped working, with people in our community. It's like, it's not the way to address this problem, right? So I think, I really think that we need to name this correctly so that we can talk about
it. As racism. Yes. Yeah, I agree. Although I do see the point that, I think with COVID-19, it doesn't have some of the sexual stigma that certainly that we saw, or the drug-related stigma that we saw with HIV and AIDS so much. And now we have social media, so everyone is like posting about when they have a family member or they themselves are COVID positive, or that they're going to take the test, and they do a little video of them taking the test. I had a friend took the test yesterday through a drive-through thing, and he had his camera sitting in his lap, looking at him while the thing was going down into his nasal passages. And I thought, oh well, that was visceral, to watch that. And then I thought, there's a lot of people that are going to be like afraid of actually going in and getting the test, or even think that to get the test is going to potentially expose them. There's a lot of people that don't understand, what the test is and what it's about. So I think it is important that people are talking about it.
Right.
We have celebrities that are talking about it too, and that's important. It took years to get to that point,
Right.
with HIV and AIDS.
Right. Can I add really quick? I think there's a point during this lockdown, at least in Los Angeles, since I can't go anywhere else, where it was a stigma to be wearing a mask outside, right? People see you as like, you probably have the disease. You're inviting a lot of harassment by wearing a mask. And there was a point during this lockdown when that changed, where if you're not wearing a mask outside, then you are being stigmatized. Like, people call you out, like, what are you doing? Why aren't you wearing a mask? Why aren't you staying at home? So I think I kind of want to understand how that happens, how that stigma changed, right? Because I think a lot has to do with leadership, like people in talking about like what is the most responsible thing, thinking more communally, right? Especially in California, where you do have people who rely on science to make decisions, so very clear about what to do and what not to do. That didn't happen with HIV/AIDS, at least not in the early years, right? There's so much misinformation,
right?
So I think if you want to talk about stigma that way, I think there are different ways that we can talk about how institutional response can alleviate some of those things.
Right. And some of this is about, when we have celebrities who, whether they're, they're Asian or they're not Asian, to like talk about their experiences with COVID testing or being COVID positive. I think it sort of like normalizes it in a certain sense. But still, we have specific incidents that are happening here in the United States, attacks against individuals who are Asian or Asian American, Asian Pacific Islander, that are about perceptions of COVID. And we're seeing reports on that. Can anybody like talk about what kind of reports are you seeing in the people that you know or in the media? Specifically, because I think we're kind of like talking about this as an abstraction at this point, and I think we kind of what are people hearing and seeing?
One of the things that has come to our attention at APINC through the Stop AAPI Hate That's an organization that's been working to do reporting on anti-Asian harassment and incidences and different things like that. And just in 2 weeks, they received 1,600 submissions of anti-Asian harassment, just in 2 weeks.
Wow.
And this, it's across the nation, things ranging from, people getting spit on, people getting threatened. Many of us have maybe seen the reports of folks across the country who have been stabbed or poisoned, like physically poisoned because they are Asian. To now in San Jose, just this past weekend, a lot of Asian businesses have gotten their windows broken and have, with all these signs put on with anti-Asian sentiment related to the virus. And I think that in this moment, we're seeing the ways that Asian folks, particularly East Asian folks, Chinese American folks, have always been a kind of conditional other, right? And Asian American organizing, I talk a lot, and I know a lot of other people talk about the myth of the model minority. The model minority being this idea that Asian folks are this kind of like model of what it means to be a person of color in this country. This was a phrasing specifically leveraged to demean and undermine Black folks in this country, especially. But that myth of being a model minority has always been predicated on what's helpful to the dominant power structure. And I think in this moment, the myth of being a model minority, the myth of being safe as an Asian person is coming out as obviously untrue. Like Asian people are subject to this extreme xenophobia and are only conditionally safe. Many folks who are also being deeply impacted by the anti-Asian harassment in this moment live at the intersections of other issues and identities, right? We're seeing that women are being targeted more than men, older folks, people who are seen as immigrants, people who are gender nonconforming are being targeted at higher rates. And I think that all of those existing lines, divisions, and marginalizations are coming up clearly in this moment. And it's so deeply unfortunate that, like someone was saying previously, the leadership of this country has not only been silent, but has allowed for this to happen, has perpetuated this on a federal level so that it becomes reinforced and okay on every single local level that's happening.
That's a really great analysis. I always love hearing you, Sammy. You've always got such wonderful insight, and I'm looking forward to seeing some writing from you on this subject, actually. So, we've got, we have a healthy discussion going on the side here on the chat with some resources getting posted in the chat box and people making comments that I think are very much in line with the things that that we're hearing from the panelists. I can go back and look to see if there are any specific questions, but if people do have questions, please use the Q&A function. We only have about 17 minutes left in this forum, and I do want to give everyone a chance to make any kind of closing kind of remarks as we wrap up. But if there are questions, some people may be using the chat function instead of following directions and using the Q&A function, but it doesn't really matter. So let's see. I want to direct it towards the present and the future even more than we have so far. And I think we've talked about how COVID and how AIDS sort of exposed some of the cultural inequities, the social inequities that were already pre-existing in our society. And in some ways, how the response to the disease is, certainly with AIDS, helped to address some of those inequities, at least on a temporary basis with some people. And we could get into talking about that in a lot more depth, but I'm wondering, what have you guys thought about with respect to COVID and how COVID could, people talk about with AIDS how there's this question, sort of that theoretical exercise, that thought experiment of, if we had not had AIDS, what would have been the trajectory of the gay rights movement? And some people will argue that, well, a lot of people wouldn't have died, and we would have, and continued the path of civil rights around gay LGBTQ rights. And then others say, well, actually, AIDS helped us to really get organized and to get focused and raise a lot of money, and really, although we lost people, really focus our efforts, and it really propelled us even further and made people understand and empathize with gay people more when they came to learn about how AIDS was affecting us and how we were responding it. So looking at that history, what about COVID? And specifically, what about COVID and racism, and what we're experiencing now, in particular with Asian Pacific Islanders and with African Americans? Do you see COVID as furthering the discussion in a helpful way? And if so, how? Or is it going to be furthering and deepening the racism that we already have in our culture?
Well, I suppose we could ask people, how many epidemics or pandemics does it take before people learn? Because, what's it going to take? And I think, I think Eric kind of alluded to this earlier. I think it's important to be hopeful at times like this, because if you just think everything is a disaster and it's not going to change, but what it does do is it kind of gives you a sense of what kind of world you want to live in, what kind of leadership is needed. We talked about some of the anti-Asian stuff. We didn't talk about the kids in schools who are getting beat up and bullied, and what kind of trauma that's going to have, because they're going to grow up to be adults, and what kind of help is ready for them. And I just think that, it's important to be helpful, and I don't know what it's going to take. I just think we have an opportunity right now to kind of figure that out. Voting current leadership out of office might be a way to start. Coming together, like we've kind of said, but then having a vision that we could work toward, that people can buy into, that doesn't seem so, because I think one of the things that came out of the HIV epidemic for me was that all the uncertainty that lasted years and years and years, but the one thing I know now is that we came out of it. And at one point we will come out of this, and what is the world that we want to step out into?
That's the question. I think we have a good sense maybe on this panel, but when we do have a president who's calling it the Chinese virus, and I don't know if he's still doing that, but just the fact that he has done that and not even apologized or tried to correct it, he just should not be speaking at all about anything in relationship to this or any matter at all. But and yet he's there, and I think there is a power of the presidency, and that trickles down to the schoolyard. When you talk about kids, I think, and I think about my own experience as a young queer kid, and you think about a young Asian American kid that may be hearing that kind of bullying now, and I think that's what you're alluding to, Vince. But I maybe not. I don't know. Eric,
no, I was gonna say I wasn't clear. Let me try again. No, I'm teasing.
Okay.
I have a quick comment on that.
Yeah.
When we're a capitalistic society, and obviously, corporations have a huge influence in this country, and every corporation has a CEO, and it's that CEO, or in your case, Terry, an executive director of an organization, and it's their attitude and their ideas and their vision that filters down and focuses and guides the organization. And if you look at the presidency as kind of a CEO of this country, that attitude and that way of dealing with the world is going to filter down throughout the entire country. And I agree. I hope we get a replacement of that CEO. And also, I feel that kind of my final comment is that the way to make the difference is to, we're kind of like in a standard shift car. We have the clutch in right now. When we pull that clutch out and let it out slowly and we re-engage those gears, what is this country going to go for, and what is it going to remember, and what is it going to, which gear is it going to be in? And I think the best and only way that we can affect it individually is to be active individually. We have to, I sign up for committees that I will never be a part of other than to listen to what they have to say so that I can keep informed. I sign up for much more than I could ever do so that I can hear all these different things. For instance, being on a panel, here's the white kid, right? 3 Asians that are giving me things that I know because I live with Vince and hear it and work with it, but viewpoints and information that is much deeper than anything I normally encounter. So
Yes.
by being here, I'm educating myself and I'm learning how to adjust adjustments that need to be made.
That's why we invited you, is to educate you, Harry. So no, I appreciate that.
Three
And I learned,
fabulous Asian people, and get that old white guy too.
yeah. And and I will say, in my job, I learn a lot, from so many different things, and AIDS certainly taught me a lot about different parts of our culture that I may not have thought about prior to that work. Last week we did a panel on healthcare, healthcare workers with COVID from the perspective of people who had worked in AIDS. And it was very interesting. But one of the questions that I asked rhetorically towards the end was, so is COVID going to bring us universal healthcare? Sorry about that. My roommate's
I think your dog thinks it will.
Yeah, my roommates are getting a delivery. So let me just throw this rhetorical question at you, Eric, Sammy, in particular. Is COVID going to bring the end of racism?
That's a lot to put on one virus. COVID-19 virus.
How many viruses is it going to take? I think that's the take-home line from this whole thing. How many epidemics is it going to take? Vincent said. Yeah. So what about that? We don't think it's going to bring the end of racism. But what?
No, I don't think it was going to bring the end of racism. I do think that, like, how people talk about evolution, like you kind of go steady, and then all of a sudden you make this jump. I think we are at this inflection point where a lot of these things that we didn't think was possible 2 months ago might become more feasible in the advocacy arena. And one of those things I think might be healthcare access. Like, how do you prepare for the next virus, right? That's what leaders should start thinking about. Like, how do we make sure that your communities have what it takes to weather another crisis like this, because it won't be the last. No one believes that this is going to be the last lockdown that we'll ever have in our lifetime. So how do we prepare for this? Like, even the argument that how do we pay for it? Like, I think those arguments, would it work again? I don't know. It's like the economy was pretty much shut down because of this. Like, at least like 80, I want to put, a majority of the economy was pretty much shut down because of this. But yet we're still able to, there's enough money in the world, so we should stop asking how we pay for it. So there are all these things that I felt like, I'm not in the advocacy world, but I felt like a lot of these arguments that we use to sort of turn back progress or stop progress might not be as strong as they used to be. That's my hope, right? So I think there's an opportunity, maybe not to eradicate racism completely, but at least begin to raise all these disparities that we're now seeing, that COVID-19 is really making it visible.
Yeah, I agree with that. I think that, well, I guess I'll come back to one of the things that grounds me in movement work, in addition to all our histories as a community, is this idea that world transition is inevitable, right? Like, things are always transitioning. Climate is changing things. Things always happen. So transition is inevitable, but justice is not. And justice takes work, right? We are learning, like Eric said, that so many things are possible in this moment that people have always said are not possible. Like, there's no way we could cancel rent. There's no way that we could have healthcare for all these people. There's no way we can house all the folks that are currently homeless. And yet it's happening, right? There's no way we could release more people from jails. it's all of these things are happening and things are fine, like relatively fine. And so I'm thinking about what can we learn from this moment and how can we codify these wins? If these are things that are actually improving society, how can we codify those into actually just being the new norm that we're trying to make? There are things that seemed for me previously just unimaginable as a win or felt like it was going to take decades to try to manifest that seemingly overnight are just happening now because they are absolutely necessary to protect people. And everyone is on board with protecting people, or at least a lot of people, more people than before, are thinking about universal protections for folks who are marginalized, sick, and have needs in this society. And so I am really, really interested in moving forward to look at the wins that previously looked unattainable and understanding how we can codify those as real to continue supporting the fullness of who people and societies and locales are.
Yeah.
That's really great, and I'm going to use that as kind of a segue to just do one last quick go around. And I apologize to everyone who has, if you had a question that we didn't get to, but I sort of felt like we did touch on everything. And I see that everybody that put a comment in the thread there, everyone could see that. That's watching and participating, and so so I'm glad that we've had this parallel conversation kind of happening. But I wanted to just in the few minutes that we have left kind of like go around and only just less than a minute each, but if you could like say what is needed now, and some of you have said some of this already, but just to put a point on it, do we have enough media attention? Do we have enough leadership? Where should that leadership attention come from? What should those media stories be about, perhaps, that can help to counter the stigma that is inhibiting the appropriate response to this disease and hurting people in their daily lives? Can we go around and start with Vince and just a few final thoughts?
I was going to defer to everybody else first.
Oh, sorry, I forgot. You like to go
No, I'm
last.
teasing.
Okay.
Yeah, go ahead. I'm still percolating. I'm calming down because I have to go cook dinner after this.
Oh, okay. Well, next, Harry.
Oh,
just briefly.
what to do?
Just briefly.
I don't know that I can say any more than just follow your heart, get out there and do it, and find what makes you tingle inside, I guess, to know what's right and wrong and follow your heart to support the things that are right and to depower the things that are wrong and speak out. We must be heard. If we're not heard, silence equals death. It's not a new one.
Thank you, Harry, for your wisdom. Eric.
We didn't really talk about this, but I've been thinking about young people a lot. I felt like as I get older, I just feel like every year that goes by, we just leaving a shitty world to the young people. Like first the 2016 election, the climate change, and now this. But I also think that they are very resilient. I work with a lot of youth serving organizations, and I think there's a lot of creativity that's happening there, and people are actually being galvanized to do things, just like I think AIDS galvanized my generation into activism. And so I felt like we need a lot of investment in youth development and just making sure that they become the leaders they're destined to be.
Great. And Eric, we've gotten several messages of love for your dog, and so your dog is basically stolen the show almost. Sammy, Vince, any quick final to-dos?
Actually, Sammy, why don't you go last after what Eric said? Because why don't you have the last word? But, I just want to say that I'm actually shocked at how strongly I feel about a lot of this stuff, but I realize I feel this way because it matters to me. Like, I do not want to see my community go through another, pandemic, to be hurt, to be vilified. And like what Sammy had said, we are seeing like, remember the lessons that you learned from this? Like, we're redefining who's essential. We know that healthcare is something that is definitely needed. We know that leadership needs to be changed, and don't forget that. I think with the AIDS epidemic, one thing that happened is it was such a painful thing that when it was done, when the meds came out, people just wanted to forget about it and push it away and then just get on with our lives. And now I know a lot of people in the 50 Plus network are reliving a lot of that trauma. And then, focus on resilience. It's important to cultivate, to know that we have that, but to cultivate optimism and hope. And then that way, hopefully the younger people that we leave the planet to will have a better world.
Great. Yeah, thanks. I really appreciate your passion. Sammy.
Yeah, just briefly, what I always come back to in trying to understand how to be resilient is the understanding that when the strength of our relationships is more powerful than the institutions that undermine us, we can start to build a new society, right? And so if we focus on our connections, if we ask for help, if we do the personal growth needed to transform ourselves, we can also transform our world into the just thing that it can be, but it's gonna take a lot of work and it's gonna take a lot of commitment and rigor. And now is the time to learn and figure out where you as a person can build the necessary connections, where you wanna commit and be rigorous with it. And if we are able to do that together in our neighborhoods, in our buildings, in our community centers, in our ethnic communities, in our identity-based communities, we're gonna have a better world on the other side of this.
Great. I really appreciate your clarity, Sammy. All of you, I love you, and I wish you great health and happiness for your chosen and families of origin. And I just want to plug next week. We're going to be talking about pandemic sex. So yeah, come back, join us. So with that, I'm going to say thank you, Lee, for helping to do the tech stuff behind the scenes. And thank you all for joining us tonight. And thank you, everyone who participated. Support the Historical Society at glbthistory.org. Join as a member. We need your support. Thank you.
Thank you, Terry. Thank you, Lee.
Thanks everyone for coming.
Have a good night. Oh, and hi to my boyfriend.